Hello. Thank you so much for the introduction, and thanks students in public health for selecting me to be here. I'm a clinical psychologist, and I teach graduate students in the School of Public Health and also in the Department of Clinical Psychology. And what I'd like to speak with you about tonight is the public health approach to problems and how this fits in with mental health specifically. So at its essence, the field of public health focuses on optimizing health. But it does so in a slightly different manner than the medical model, in that its focus is on prevention and on early intervention. And so what this means is that if we were to consider health and illness on a continuum, what we typically think of with respect to healthcare intervention is here, the point of illness or pain or injury, some clinically significant threshold at which we would apply treatment. The field of public health, however, seeks to intervene a lot earlier in the process, either at the very earliest stages of disease or even in a state of wellness, as a blanket approach applied to everyone in the population who might be ultimately vulnerable to becoming ill. So one example here would be to give people a vaccine to prevent the eventual onset of illness, so that even in the case of eventual exposure, one's risk of becoming sick would be reduced. So when we consider the public health approach to physical illness, there are a lot of things that we know we can do to prevent disease onset. So we have education campaigns and public service announcements teaching us as early as elementary school about things that we can do to optimize our health. So things like proper hygiene, good nutrition, hand washing, all things we can do to reduce our risk of eventual illness. Okay, so a reasonable question at this point might be, what does public health have to do with mental health? We don't really have a vaccine for depression or for anxiety. And this is true. In fact, we don't get a lot of information at all about what we can do to protect our mental health, which is really quite concerning when we consider that the prevalence of mental illness far surpasses that of other major health problems. But we do know some things about risk factors for mental disorders, which can give us some clues about prevention strategies. So risk factors include things like sleep deprivation, financial strain, chronic stress, poor nutrition, alcohol and other substance abuse, lack of social support, and also certain styles of thinking like pessimistic attitudes or self-criticism. So in other words, graduate school. These are all things that can put anyone at risk for developing a mental disorder. And of course, many of these risk factors are almost normative among graduate students. So it really should come as no surprise that there's so many headlines now about how grad school and med school and law school are pressure cookers for the onset of mental disorder. So from a prevention standpoint, this means that everyone should take active steps to protect our mental health by reducing these risk factors, including taking care of your physical health, get enough sleep, get proper nutrition, limit alcohol intake, but also attend to your emotional health. Reserve some time to have fun. Yes, even in graduate school. I know that's not a message that you hear very frequently, but I actually mean it. If it means putting it in your calendar and reserving the time to enjoy life, please do it, and do it without guilt because it's for your health. Also actively engage in stress reduction techniques. Spend time doing things that make you happy. Spend time with friends or watch a funny TV show. Borrow a dog and walk him. Laugh. Now, the ideal, of course, is to prevent mental health crisis. But the public health approach also means that we should seek treatment very early in the disease process, meaning that we should be informed about and take action at the earliest warning signs. So what are the warning signs? In formal practice, the field of mental health considers the threshold for disorder to be the point at which emotional difficulties interfere with our social or occupational functioning. So this means that relationships are suffering. We might be getting in frequent arguments, withdrawing from friends, or occupational functioning, not being able to get work done, missing deadlines. When these signals are present, please seek help. And so Yale students, here's what I wish to inspire you to do. Please be sure to engage in self-care for your mental health. There is nothing so unique about being a student at Yale that affords you a buffer from mental distress. And in fact, there might even be some evidence to suggest that the reverse is true, that the unique pressures of graduate school make this a very vulnerable time for the onset of mental disorder. And there are some things that you can do to build your resistance. I'd also encourage you to actively seek help if it gets to the point that you're having difficulties with your work or in your social life. There are, of course, multiple ways to seek action. There's formal counseling with a mental health professional, and I'll get to issues surrounding that in just a minute. But there are other effective actions that you can take, such as engaging in self-help, enrolling in support groups, or speaking with a trusted member of your community, like a pastor or a rabbi. For the Yale administration and faculty, I would like to inspire the incorporation of a public health approach to mental health on campus. Taking a public health approach means that those of us in healthcare need to figure out ways to provide wellness programs aimed at prevention. It would be critical for this system to provide counseling services well before students reach the point of crisis. If the student health system is only able to provide limited services, then we need to figure out ways to provide support through other means. And we also need to work on shaping a culture that encourages immediate reactivity, including education efforts aimed at faculty knowledge and sensitivity. Currently, many students perceive obstacles to obtaining mental health services, including a concern that admitting mental distress could be harmful to their careers. As faculty and administrators, we must figure out how to change that perception. Students should be encouraged to seek mental health services without a fear of academic repercussions, and they must have access to immediate and affordable services. In conclusion, here is my hope for the future of Yale, as depicted in this poorly photoshopped image of Harkness Tower with green lights to represent mental health awareness. I have faith that this is the administration at Yale that can change the culture surrounding mental health, and I hope that we in the field of public health can be helpful in the effort. Thank you so much.